Thank you for watching the video. This is YouTube Medical University. About 5 million Japanese people suffer from chronic constipation. And among them, 1 out of 3 people doesn't have a problem with their intestines moving, but rather, the stool is almost there. The stool has arrived but won't come out. This is called outlet constipation. The official term is defecatory disorder type constipation. And there's a shocking fact I want to share with you first today. People with this type clench their teeth in the bathroom and strain with all their might, turning their faces red. Medically speaking, the more you do this, the harder it becomes to pass stool. It might be the same as locking the exit for your stool yourself. So what should you do? Actually, what you need to unlock that is not force but technique. So, this time, we're talking about outlet constipation. For those who have stool right there but can't pass it, I'll introduce 3 specific solutions. And in the second half of the video, I'll also explain a certain pitfall that people who think fiber is good for constipation and eat a lot of it should know about. For people with outlet constipation, doing this can actually make things worse, so please watch until the end. Now, here is today's agenda. In the first section, I'll quickly introduce 3 ways to relieve outlet constipation. And in the second section, if things still don't improve, what kinds of specialized treatments are available? I'll also talk about some unexpected dietary pitfalls. First, and finally, in the third section, if you have these kinds of symptoms, it might not be constipation, but actually a certain illness. At the end, I'll talk about symptoms for which you should go to the hospital without hesitation. Now, the first section. Here are 3 ways to relieve outlet constipation at home. The first method for relieving outlet constipation is this. Sit in the thinker's pose. First, please change the way you sit on the toilet. Specifically, it's like this. It's a pose like the thinker. Please prepare a footstool about 15 to 20 centimeters high for your feet in the bathroom. Even a step stool from a dollar store will work. Stacking old magazines is fine too. Put your feet on the stool and bring your knees above your shoulders. Your knees and shoulders are at very different heights, aren't they? So what should you do? With your feet on the stool, lean your body forward. Rest your elbows on your thighs and take this kind of pose. If you're wondering, will that really work? There's medical evidence supporting it, based on research from Israel. They had healthy men and women take on 3 different postures. The posture of sitting on a regular height toilet, the posture of sitting on a low toilet, and finally, the squatting posture. As a result, the squatting posture led to shorter bowel movement times. On average, it took 51 seconds, which is less than half compared to the 130 seconds when sitting normally, and the amount of straining required was clearly much less as well. In a study conducted in Ohio, United States of America, participants tried using a footstool for 4 weeks. And not only did their bowel movement times become shorter, but they also reported a feeling of completely emptying their bowels. It was reported that this feeling increased by about 3.6 times. Why is the squatting position better? Well, that's only natural. Please take a look at this image. Our anus and the rectum behind it are actually not connected in a straight line. Normally, it bends at an angle like the letter L. Medically, this is called the anorectal angle. Why is it bent? The reason is simple. If it were straight, just by standing and walking, stool would keep coming down and leak out. So, to prevent leakage, it bends at an angle as a natural stopper. The problem is, trying to have a bowel movement while it's still bent makes it hard for stool to pass. It's like a garden hose. If it's bent, water won't flow well. That's why you use a footstool or something similar. If you lean forward, the angle of the anorectal junction gradually widens and the passage becomes straighter, making it easier for stool to pass. That's why it made sense for Japanese people to squat over traditional toilets. I think it's easier to understand if you remember the reason, so let's learn together. 3 ways to relieve outlet constipation. The second one is to bear down while exhaling. Isn't this a bit surprising? Most people tend to hold their breath when having a bowel movement. Aren't you clenching your teeth and straining? Actually, this is the worst way to do it. It's actually like locking the exit itself, but here's the correct way. First, slowly inhale through your nose and feel your stomach expand as you do. Next, purse your lips and exhale slowly, like you're blowing out a candle. Imagine breathing out in a thin, long stream, gently, as if you're making a candle flame flicker. Try exhaling like that. As you breathe out, gently tighten your stomach with about 50 to 70% of your strength, applying light pressure. Please don't do it with your full strength. About 50 to 70% is enough. If you understand the reason why you shouldn't do it with full force, it becomes easy to understand and interesting. Actually, our anus has two locks. The first one is the internal anal sphincter, which is an inner muscle that tightly closes the anus. And then there's another lock on the outside, which is the external anal sphincter. This also tightens and closes the anus. The first one, the internal anal sphincter, is actually controlled by the autonomic nervous system, so we can't control it ourselves. You can't relax or tighten it at will. And the second one, the external anal sphincter, is called a voluntary muscle. It's a muscle that we can tighten or relax ourselves. These two muscles together make up the muscles of the anus. In a healthy body, when stool moves down inside us, the internal anal sphincter naturally relaxes first. When that happens, we feel the urge to have a bowel movement. I need to go, but there's no bathroom right now. So, with the external anal sphincter, the outer muscle, we consciously tighten our buttocks. Then, when we go to the bathroom, we relax the external anal sphincter and we have a bowel movement. However, for people with outlet constipation, this coordination is disrupted. When trying to push out stool, the external anal sphincter, which acts as the outer door, closes instead. Medically, this is called pelvic floor muscle dyssynergia, meaning the muscles aren't working together properly. It's a condition where you can no longer control the tightening and relaxing movements of your anus. Using a car as an example, it's like the accelerator helps you pass stool while the brake holds it back, are being pressed at the same time. No matter how much you rev the engine, if the brake is on, you can't move forward, right? In that state, if you hold your breath and strain, your muscles get even more tense. The brake gets even stronger, so the harder you try, the less likely it is to come out. On the other hand, if you strain while exhaling slowly, the muscles in your pelvis relax more easily, and it's thought that by releasing the brake first and then pressing the accelerator, it's easier to pass stool. Please be mindful of the order. Here is the third method for relieving outlet constipation. It's to make a habit of sitting on the toilet in the morning. The third point is about when to go to the bathroom. To get straight to the point, everyone should try to sit on the toilet within 15 to 30 minutes after eating breakfast. It's okay even if you don't have a bowel movement. However, don't spend too long in the bathroom. If nothing happens after about 5 minutes, just wrap it up and leave. Why should you sit on the toilet even if you don't have a bowel movement? Our bodies have a reflex where, when food enters the stomach, it triggers the colon to start moving. This is called the gastrocolic reflex. This reflex is said to occur especially after breakfast, right after you eat your morning meal. In other words, after breakfast is the best time when your body naturally tries to open the exit door. And what is common among people with outlet constipation is a decreased sensation in the anus. Even though they've eaten breakfast and the stool has come down, there are people who don't notice that sensation. They skip the bathroom because they don't feel the urge to defecate. The stool keeps building up, but they don't notice it, and as it keeps accumulating, their sensation becomes more and more dull. It's easy to fall into this kind of vicious cycle. To break this cycle, please make it a habit to go to the bathroom after breakfast, even if you don't feel the urge. This way, you teach your body that it's time to have a bowel movement. On the other hand, aren't there times when you hold it in and suppress the urge to go, like during work or an important meeting, thinking you can't go right now even if you're constipated? If you keep doing this, the sensors in your colon will gradually become less sensitive. So try not to hold it in. When you feel the urge, go to the bathroom. Please make it a habit to do so. And another important thing is to never ignore the urge when it comes. That's the golden rule. And there's one thing to be careful about. Earlier, I mentioned that you shouldn't stay in the bathroom for more than 5 minutes, and that's also important. If you spend too much time in the bathroom, our brains start to associate the bathroom not just as a place to relieve yourself, but as a place to take a break. It changes the way we perceive it. It's just like when you go to bed at night. If you spend too much time messing with your smartphone in bed, you'll lose the habit of going to bed just to sleep. Your brain will start to think that bed is a place to use your smartphone, so when you go to the bathroom, remember that the bathroom is just for relieving yourself. If you don't need to go, just leave. I hope you'll keep this in mind. If you really have trouble passing stool, the hospital can prescribe laxatives or stool softeners, but these kinds of lifestyle adjustments are still important. There are actually people whose constipation has greatly improved just by changing their lifestyle habits. Please give it a try, even if you're skeptical. That's the end of part 1. We covered 3 solutions to try at home. In part 2, we'll discuss what to do if those don't work. What kind of approaches are available in such cases? I'll also talk about the details of professional treatments and some common misconceptions people have. I'll also introduce some pitfalls of dietary fiber. Let's take a short break here. So far in this lesson, have you noticed anything you've tried yourself? Things like using a footstool, your breathing, or your habits after breakfast. If you found even one thing interesting, please give us a thumbs up. And I'd be happy if you subscribe to the channel so you don't miss any new videos. At YouTube Medical University, just knowing these things can change your body. We share easy to understand medical knowledge like this from the perspective of a practicing doctor. Moving to the second period, some people tried all 3 methods in the first period but still couldn't have a bowel movement. Honestly, this always happens to a few people, especially those who have endured constipation for many years or haven't taken any measures against it, or those who have developed a habit of holding their breath and straining. People like this tend to have a hard time getting better. Even if they try to relax their buttock muscles on their own, they may have lost the sense of how to do it in the first place. In such cases, specialized training may be provided for these individuals. This is called biofeedback therapy. It might be an unfamiliar term, but this is the treatment provided for people with outlet constipation. It's the first choice treatment. What you do is simple, but it's a bit specialized. A small sensor is inserted into the anus. Then, the movements of your anal muscles are displayed in real time on a monitor in front of you. And when you're told to bear down, you can see on the screen whether your muscles are contracting or relaxing when you apply force yourself. Many people with outlet constipation are surprised to see that even when they think they're relaxing, the screen shows their muscles actually tightening further. This treatment, called biofeedback, provides feedback on the gap between what you think you're doing and what is actually happening. This treatment is highly specialized, so it is not available at every hospital. Even within gastroenterology, this treatment is offered at facilities that specialize in constipation clinics or anal function. If you're interested, search for biofeedback and constipation. And try searching with the name of your area as well. Now let's talk about another topic, the pitfalls of dietary fiber. You might think you're doing something good by eating dietary fiber, but sometimes it can actually have the opposite effect. When it comes to constipation, people often think of dietary fiber. I believe many of you already know this. Everyone and their cat says that dietary fiber is good for constipation. Because of this, a lot of people think it's okay to just eat fiber whenever they can't have a bowel movement. However, for people with outlet constipation, there are restrictions on the types of dietary fiber they should choose. There are 2 main types of dietary fiber: insoluble dietary fiber, such as burdock root, sweet potatoes, and brown rice. This type of dietary fiber increases the bulk of your stool. And the second type is soluble dietary fiber. Foods like seaweed, okra, and oatmeal contain this type, which helps your stool retain moisture and become softer. For regular constipation, meaning when your intestines are sluggish and stool doesn't move forward, increasing stool bulk with insoluble dietary fiber is an effective strategy. However, outlet constipation is different. With outlet constipation, the stool has reached the rectum but can't come out. If you keep consuming more and more insoluble dietary fiber in this situation, the bulk of the stool will just keep increasing. But since the exit doesn't open, outlet constipation can actually get worse. Your abdomen keeps getting more bloated and uncomfortable. And even though you try harder and harder to push, the more you strain, the tighter your anus becomes. This can easily turn into a vicious cycle. It's like pouring more and more water into a sink with a clogged drain. That's what it's like. So the first thing you need to do is clear the clog in the drain, right? That's why your posture and breathing are so important. On top of that, when it comes to adjusting your diet, if you have outlet constipation, you should focus on soluble fiber. It helps make your stool softer and smoother, making it easier to pass through the exit. Recommended foods include slimy vegetables like wakame, mekabu, mozuku, and okra. Please remember these. Please remember slimy vegetables. Oatmeal and barley are also recommended. However, if you increase these all at once, it may cause bloating, so start with a small amount and gradually increase it over 1 to 2 weeks. Gradually increase the amount while checking how your stomach feels. And finally, let's talk about how to use medication. People with outlet constipation often rely on stimulant laxatives, such as ingredients called senna or bisacodyl. These are medications that force your intestines and stomach to move. However, if you've watched up to this point, you understand, right? With outlet constipation, the exit is closed. Even if you force the intestines before the exit to move, it will only make your stomach feel bloated and painful, and it will still be hard to pass stool. So relying on stimulant laxatives, which make your stomach move, is not really a good idea. They are recommended as a rescue option when you really can't go, but it's better to avoid using them regularly. If there is a medicine that suits people with outlet constipation, it would be the type of medicine that softens the stool. It's the same principle as water-soluble dietary fiber. If the stool becomes softer, it will pass through the exit more easily and you'll have smoother bowel movements. Medicines like magnesium oxide or polyethylene glycol may be suitable options. Well, that's the end of the second period. In the third period, we'll talk about the signs that indicate your situation is beyond what you can handle on your own. At the end, I'll share the signs that mean you should see a doctor if you experience these symptoms. But before that, I want to sincerely thank everyone who has watched up to this point. Actually, there are cases where home care alone isn't enough to improve the situation. Not all types of outlet constipation are like what I've talked about so far. Sometimes the muscles can't relax properly. It's not always caused by muscle habits. Actually, there are two main types of outlet constipation. There's the functional type, which I've talked about so far. In this type, the coordinated movement of the muscles is disrupted, but there's no problem with the actual structure itself. This is related to things like posture and breathing. Improvements can be expected through biofeedback, and the other type is called the organic type. Sometimes there can actually be hidden physical problems related to the body's structure. Let me introduce two typical examples. The first is something called a rectocele. This is when the wall of the rectum bulges out like a pocket, so when you strain, the stool doesn't go toward the anus. It goes into that pocket instead. It's like there's a pitfall right before the exit for the stool. That's the kind of condition it is. And the second one is called rectal prolapse. This is the type where the rectum protrudes out from the anus. It can range from mild cases to cases where the intestine comes out every time you have a bowel movement. In these patterns, muscle training alone won't fix it, so surgery or other treatments may be necessary. So, if any of the following 5 items apply to you, please consult a gastroenterologist, a specialist, or your regular hospital. First, if there is no improvement at all, even after continuing with posture, breathing, and diet for more than 2 weeks. Second, if you can't have a bowel movement unless you press around the anus or vagina with your finger. Third, if you have a sensation that something is protruding from your anus. Fourth, if there is blood mixed in your stool or you have experienced sudden weight loss. Fifth, if you are over 50 years old and have recently developed constipation. Please pay special attention to these last 2 points. Blood in the stool or weight loss could be signs of other diseases such as colon cancer. Since it may not just be a problem with constipation, please be sure to consult a medical institution. How was it? Let's review the most important points from today's lesson. General constipation occurs when the intestines move slowly and waste doesn't progress. This can sometimes be managed by increasing dietary fiber or using laxatives to stimulate the intestines. However, in the case of outlet constipation, since you don't know how to open the anus, medicines that stimulate the intestines won't solve the problem. What is needed is to teach how to open the door. This includes posture, breathing, and biofeedback methods. I have introduced these methods. I introduced 3 solutions, right? The first solution is to use a footstool and sit in the thinker's pose. This helps straighten the anorectal angle and smooth out the bend, like straightening a hose. There is research data showing that squatting reduces the time needed for bowel movements to less than half. Second, don't hold your breath. exhale gently and strain with about 50 to 70% of your strength. Release the brake before stepping on the accelerator. Third, make it a habit to sit on the toilet after breakfast. Even if you can't go, finish within 5 minutes. Don't hold back your bowel movements. Make use of your body's natural urge to go. And one more thing, when it comes to meals, prioritize soluble fiber over insoluble fiber. Try starting with sticky vegetables or oatmeal in small amounts. You don't have to do everything perfectly, so just pick one thing that you think you can do and start practicing it from tomorrow. I'll do. Please let me know in the comments which one you'll try. If you ate something that helped with your constipation, please share it in the comments as well. I'd love to hear about it. If you like this video, give it a thumbs up or down. I appreciate your feedback. And here at YouTube Medical University, as an active physician, I share information that will help you stay healthy starting tomorrow. In a society overflowing with information, it's important to have at least one reliable source you can trust. Well then, that's the end of today's lesson. Please take care of yourself and I'll see you in the next video.